We can see a bucket handle tear which we can reduce. This is almost a red-white junction bucket handle tear, and there are many ways to repair it, but we will be demonstrating the repair with the innovative Ecostitch device, which is an inside out technique of repairing the meniscus, but you don't have to make a incision on the posterior aspect. Here there is an anchor which is loaded onto the needle. So the Ecostitch system is a very innovative system developed by Osteocare, in which you have two needle based anchors. The first needle, here we can demonstrate, see here, is a green loaded anchor, and the second anchor that will be seen is a blue thread loaded anchor. So what we do here is we pass both the two needles outside of the meniscus. There is a special slotted zone specific cannula which is used for this particular device. So what we need here is we need to pass both the anchors just beyond the meniscus. Here it is imperative that whenever you pull the anchor, you don't pull it very hard, but you pull it gradually in a very gentle manner. So when you pull the anchor will be deployed just beneath the capsule, just posterior to the meniscocapsular junction. So one by one, both the anchors are deployed on the meniscocapsular junction. Once that is done, there is a cinch loop which is slowly tied, and we can see that the meniscus is reduced nicely by the use of this, and we can use a knot pusher to gradually tension the knot into its place, and we can use one or two half hitches to actually secure the knot into its place. Now here, as compared to any other meniscus repair devices, the hole that we make in the meniscus is very small. The size of the hole is 0.8 millimeter, which is the smallest of all the meniscus repair devices. So this first anchor is placed on the posterior part, and then we will be passing the second anchor, and the second anchor will be placed almost in the body of the meniscus to reduce the body onto the remnant rim of the meniscus. Here we can see that the first needle is inserted and the second needle is inserted onto the peripheral rim, and when we pull the needle out, again the blue and the green sutures will be visible, and slowly the blue and green sutures will be loaded one by one so that they are deployed on the posterior part of the meniscus. Again, a cinching is performed which will actually reduce the meniscus into its place. As we do the cinching, the meniscus is now reduced very nicely with the help of the knot which is pre-tied into the Ecostitch system. After that, I would again do 2 to 3 half hitches to secure the knot, and thereafter I would cut it with a knot or a thread fiber wire cutter. Here the point to emphasize is the hole that is made in the meniscus is smaller than the all inside devices, and the thread that is used for the meniscus repair is thicker than the inside out devices. So effectively we get a very nice purchase of the meniscus, and iatrogenic damage to the meniscus is minimum. Now we are using the third and the most anterior part of the tear repair, and this repair is usually performed again by the uh, system. The important thing here that you should always consider is that it is a slotted cannula, and you have to always remove the first thread completely from the slotted cannula before putting the second needle in, because if you don't do that, then two of the threads may intermingle and causes technical difficulty during the surgery. Here again, the anteriorly the peripheral anchor is unloaded, and the second anchor, which is onto the meniscus, is again deployed from the meniscus. Once the meniscus, both the anchors are deployed into the meniscus, again the cinching loop is tied in a perfect way, and we can see that the meniscus is repaired very nicely to its peripheral rim. So overall, in a bucket handle scenario, this technique is a very flawless technique to perform a low profile, low iatrogenic damage, strong repair of the meniscus, and it is also cost effective technique. So here what we can see here is with three Ecostitch devices, the bucket handle tear of the meniscus has been repaired very nicely into its position, and you can see that the whole of the meniscus is repaired very perfectly. We will be performing an ACL reconstruction concomitantly, and then this patient is, we are expecting